Good afternoon, everyone, and thank you for joining us for the prior year 2020 Objective 7 Health Information Exchange Summary of Care Instructions for Referrals and Transitions. This presentation is provided through a shared commitment between Access, ADHS, Health Current, Myers and Stofers to increase participation in the Medicaid Promoting Interoperability PI program. A few logistical reminders for today. Today's webinar will be recorded and posted to the Health Current and Access websites. Please use the chat box for questions and comments. Please include your name, practice, or organization information, and do not include any confidential information such as patient health information or PHI. Again, all lines are muted. Connie, are you with us?
I am. Can you hear me?
I certainly can. Would you mind introducing today's presenter?
I will be happy to. I'm honored to be able to have our presenter today, Cindy Manning, who is a Health Current Information Exchange account manager, and she is our presenter today. Cindy has been with the HIE for approximately 3 years, actually 3+ years if I remember correctly, and has experience working with over 150 of our HIE participants. So she is a great presenter and she has a lot of information to share. And please feel free to ask questions at the end as well. So Cindy, take it away.
Thank you, Connie. Well, welcome to my presentation. As Connie mentioned, I'm an account manager for Health Current. I'm going to be presenting some tips and techniques and methods to extract the information that is important to complete the objective. We may have some participants on, and we may have some people on that are not our participants, so I wanted just to give a very brief overview of Health Current. We have an excellent website, and on the website you can see the data providers and the data types that they share, and you can expand them. You can search for a particular entity, as well as you can download the list periodically. Now, if you are not a participant of Health Current, please contact Jamie Pink at recruitment@healthcurrent.org, and this link will be able to send an email for you as well. We have a lot of benefits of the Health Information Exchange, the HIE. We also have general types of information that usually are provided. We have Part 2 data. We have ADTs, those are admissions, discharges, and transfers. And we have clinical information as well. The clinical information may be a continuity of care documents, CCDs, or HL7V2 messages. And they might contain immunizations, medications, problem lists, lab or radiology reports, treatments, procedures, allergies, and other clinical documents. So we're going to review some of those documents a little bit later in the presentation. So today we're going to be working with Objective 7, Measure 1. And so in order to count a transition of care or referral in the numerator, the action must occur within the calendar year in which the PI, the EHR, reporting period occurs. The referring EP must have reasonable certainty of receipt by the receiving provider to count the action toward the measure. An EP must have confirmation of receipt or that a query of the summary of care record has occurred in order to count the action in the numerator. The initiating EP must send a CCDA document that the receiving provider would be able to and also be capable of electronically incorporating as a CCDA on the receiving end. In other words, if an EP sends a CCDA and the receiving provider converts the CCDA into a PDF, a fax, or some other format, the sending EP may still count the transition or referral in the numerator. However, if the sending provider converts the file to a format the receiving provider could not electronically receive and incorporate as a CCDA, the initiating EP may not count the transition in their numerator. Since we may have some new participants, and also we may have members that are not a participant of the HIE, I'm going to start from the very beginning. So you're going to get a HIE user account assigned by your organization that has been transmitted from Health Current. You're going to go to Mirth Results, and you must also have a webmail address as well. So you're going to log in here, and you're going to put your username, and that is your username, the account ID, not your email address, and a password assigned by Health Current. The first screen that you're going to come to is the portal, and you're going to be able to select a patient. Prior to selecting your patient, you must have the patient first name, you must have the patient last name, you must have the patient date of birth, and the search reason. So the search reason we're going to use today is transition of care planning. And we've got the last name, the first name, and the date of birth, and then you're going to hit submit. There may be more than one patient with the same name listed, different date of birth, or that might be the same patient for any reason at all. But what you can do is you can hover over and you can see the patient details. That'll have their current name, the date of birth, the gender, and it may or may not have the Social Security number. After you click on submit, then this is what the first screen you're going to see. This is the patient summary. And you're going to see multiple clinical sections are assigned to the same box in the grid. And the clinical section names appear in the tabs at the top of the box. Right now, we have data limited to last 30 days. And so there's really not any data in that occurred for this patient in the last 30 days. So what I'm going to do is I am going to show all data, or you can also data limited to the last 30 days, data limited to the last 60 days, and data limited to the last 90 days. So right here in the patient action box, I'm going to hit show all data. A little box will pop up asking if you really want to do that. It might take a minute. And now we have show all data. You're going to notice that that link has been removed out of the patient actions, and you're also going to notice there is a lot of data in here now. And you're going to see in the parentheses the number of documents that are in each tab right here. So we've got 1 lab, we've got 3 allergies, we've got 5 medications, 2 immunizations, 2 procedures, 2 inpatient encounters, and 3 ambulatory encounters. Also, when you click more right here, you're going to see other encounters, and there'll be other encounters are 2. We've got 2 emergency and 2 inpatient. Right now, I'm going to look at an urgent admission type. And if you hover over here, a pop-up box will give you more details. And just a brief overview of it, it'll give you the attending physician, the referring provider, if it's known, the reason they presented themselves, the data source. The source is the reporting facility, the date of the event. It says duration 1 day. The subject, it's inpatient. Admission type was urgent, and the encounter was for cardio. And where appropriate, these pop-up windows may also have links to other related data. So we picked one, and then we clicked here to view condition details, and another box will pop up and give you some more information, such as the diagnosis type, the name, the source information. We're going to start by downloading a summary PDF. And so you click on download summary PDF, and I've done it this for our first example without a date range. So there was 13 documents. You can download it or you can print it out. The next one, I'm going to narrow it down just a little bit. I just want to see some more information that occurred at an event. So now it's 4 pages, and you can download it or you can print it out. You also can share it and send it. So when you download it, they'll hit download. I recommend downloading it to your desktop, easy to find, but also go by your organization guidelines as well, because it is PHI. Then you're going to select webmail right here. Then you're going to compose. You're going to select the recipient from your drop-down box here. You're going to select and attach a file, which is the saved file on your desktop. You're going to attach it right here. You're going to select it. Then you're going to select upload. You can compose the message. Then you're going to confirm, select send. And then in order to confirm the message sent, you're going to go to the send box. So here it was successfully sent. Now on the receiving end, in your organization email, you're going to get a notice. You have received a new direct message. You're going to click on this link and open it up. And there is the patient summary that was sent by me to me. But I always recommend patient name and what the summary is and the date range. And you can see who sent it. You can also open an encounter in Mirth webmail as well. So I wanted to go over that. And when you get your document, so you've opened up the email, you've gotten your document, you're going to click on it. You can save it again where you need to save it. And then here is the document that was sent, that you received. You can also share a patient summary. So we're going to hit share. And I'm going to select the whole summary, and I'm going to pick a recipient. When you click on share, it'll pop up a box. You select your recipient, and I'm going to send it as a PDF, and I'm going to hit share now. And again, here it is, right here. It was successfully sent. And again, you'll see the same 4 documents in PDF format. So I'm going to download a CCD. I'm going to pick a date range. I'm going to hit download. And it's going to download a consolidated clinical document architecture. That's the CCDA. A dialog opens in, and I'm going to specify my date range. I already did that. And it's going to be downloaded as a CCDA. And it's going to open up in XML format. So when you do download it, look down here on the lower left-hand side, and then when you open up, this is the ingestible CCDA. I'm going to share the summary. I'm going to, again, just review this. We're going to select the group or the address, the recipient, and we're going to select it as a CCD. And then also you're going to get a pop-up box that says the message was successfully sent. Now, in order to confirm that it was sent, instead of going into Mirth Mail, we have not sent this in Mirth Mail. We've sent it directly from Mirth inside the patient summary. You're going to click shared right here. And this will give you information about who, what information has been shared and with who. So we wanted to find out some more information about what was sent. Here's the shared item, the message item, the initiate and sent date, the recipient, and the address, and it was processed with an ID number. I'm going to just review that real quick again. And now you can also go and look at clinical message notifications as well. We're back in the webmail. And so when you get one, you can show. And when you do hit show, you're going to get a hyperlinked report. I selected a table of contents. You can hyperlink anything here. And this is what it looks like. And you can go back up here and select another indication, encounters, immunizations, medications, surgeries, results, vital signs. Now, if you click on this, this is the PDF. So you're going to see that it comes out as a PDF. And the one that we're really going to focus on is downloading it. And this is going to download it. We're going to click to open the file. And it's going to download it in XML, which is, again, machine readable. And so I believe that we have met a couple different ways and methods. The machine readable is the one I believe is required for this objective. And are there any questions?
Hi, Cindy, this is Christine. We have not had any questions come through the chat box at this time. Just a reminder to participants to use the chat box to ask Cindy questions throughout today's presentation. Thank you.
So I'm just going to review some FAQs. I've got what are ADTs for people that are new to medical records. Is there a fee or a charge to belong to the HIE? No. And Connie, would you want to elaborate on that as well? She must be muted.
Hey, I had to unmute myself.
Okay.
You're asking me to describe, is there a fee for community providers to join the HIE?
Nope, there's no fee. Are there any fees for other providers, other type of providers?
Only for hospitals and for health plans.
Okay. All right. I have a couple other things that I'm going to mention. So some of the terms that we use for HIE portal user, that is individuals employed by a participant that review the data in the HIE portal. A data provider is a participant who supplies information to Health Current through their electronic systems. And then also, what is a CCD? It's an XML-based markup standard, and we've seen a couple examples of that as well. And then what a HL7 is, it refers to a set of international standards for transferring data between software applications. More importantly, what is interoperability? It describes the capacity of one health IT application to share information with another in a computable format. That is, for example, not simply by sharing a PDF, but also by sharing XML. And then another good question I've received is, what is Part 2 data? So data from this organization includes Part 2, that's the 42 CFR Part 2 information, that is afforded special confidentiality protection, and it does require a Part 2 consent to be in place for the patient's information to be viewable on the HIE portal. We get another common question, what is a patient panel? It's a practice or a payer-provided list of patients/members that they wish to receive alert notifications on. We have another one, what is meaningful use? The American Recovery and Reinvestment Act of 2009 it created the concept of meaningful use, and that is the set of criteria that eligible professionals, remember we were talking about EPs, we're also talking about eligible hospitals now, EHs, and critical access hospitals, CAHs. They must meet this in order to receive Medicare and or Medicaid EHR incentives. This is a very important question and answer. It is what a unique patient identifier is. It's a UPI. It identifies the patient by a specific UPI, and it's the one that the organization or participant has with this patient as long as the patient is active or even inactive member of their facility.
Cindy, this is Christine. We did have a question come in the chat box. Excuse me. The question is, do you expose data via the FHIR API? And what is the process of connecting an EMR to the HIE?
I can answer part of that. The process for connecting an EMR or EHR with the HIE is you need to become a participant of Health Current for our HIE. And then after you get some things in place, like the patient rights process, and you get portals set up for users, they get trained, you get alerts being sent out to them, then they have the opportunity to request to be integrated. And we have several different programs to do that. Then you would contact your account manager and they would get the process started. The first one about the FHIR API, I do not know. I'm not sure if any of our other attendees know what that is, but I do not, and it's a very good question, and I'll be glad to get the answer.
Cindy, this is Connie. I think you should get the answer from one of our other folks, and we can include it when we send out the updated FAQs. We'll include it on here. So perhaps Sally or Caitlin or someone on our team can help you with that information.
Absolutely. Thank you very much. I will, as soon as the meeting is over, I will research that and get the answer to you.
So much, Cindy. Follow up to that, is there a fee for a vendor or software company to integrate with Health Current?
I'm going to defer that to Connie and or Caitlin if they're attending.
I can do it. There is no fee for a vendor to join. However, the vendor may have a fee to the participant. In other words, the owner of the EHR, there may be a fee for that to happen, if that is the question. I think so. Is there a fee for that?
Another question coming in, could a provider who is located in New Mexico, whose patient is seen in Arizona, access the Health Current HIE information?
That's another good question. I do know that we do have a program that when an event occurs outside of the patient's home zip code where their HIE resides, that they can receive alerts. As far as you're not asking if the HIEs are connected. We do have connections with some HIEs. That is listed on our website under participants. But as far as them logging into the portal, no, they would have to have a user account and a password, and they would have to be a participant. Christine, do you think that answered the question?
I think part of that is also through the patient-centered data home and how
right,
HIE is connected throughout the country, and it is based on encounter by the zip code of the patient presenting, would send an alert back to their home HIE. For example, if somebody was in New Mexico, became ill, went into the hospital could ping Health Current through the patient-centered data home process to see if there are alerts on that patient, and then would send an alert with information back to the provider or hospital where that encounter happened.
Yep, and that comes in real handy because Arizona is a seasonal state. There is, I cover that when I do train new participants, and there also is a item on our website that describes the whole PCDH.
Thank you. Yes, that is very true for that. Another question that has come in is, what is the latency or delay in hospitalization data, meaning a patient getting admitted to the hospital?
The delay of it being reported? Is that?
I'm sorry, they have not elaborated. It is what is the latency or delay in hospitalization data?
Well, we do provide real-time alerts. And when they're admitted, they will get the event. When they're discharged from a hospital, you'll get a notification that's, an alert that they have been discharged, but they have 7 days to get the discharge summary dictated, and then it'll upload as well. Some hospitals are quicker than others. I hope that answered the question.
A reminder to our participants today that the chat box is open and we're getting some great dialogue in there. So if there are other questions that Cindy Manning can answer, or Connie I can answer for you for today's presentation, we would love to hear from you. Another question that's coming in is that, or maybe it's perhaps a statement, that Health Current, the HIE here in Arizona, receives over 98% of the hospital inpatient ED admits in the state in Arizona in real time. So if you're for that follow-up information.
Thank you, Peter. So so some of the other questions until we get another one, is the HIE a part of a state or federal government? No, neither the HIE or Health Current are part of a state or federal government. Health Current, formerly Arizona Healthy Connection, is an independent nonprofit community organization. And the benefits of the HIE to better track and securely share patients' complete medical histories. More and more healthcare providers are participating in it. It helps facilitate and coordinate patient care. It reduces duplicate treatments. It's growing among health providers because the need for HIE is clear and the benefits are significant. And then we also have what is a care plan. A care plan is the structure used to define the management actions for various conditions, problems, or issues. And it must include a minimum of the following components: goals, health concerns, assessment, and a plan of treatment. More importantly, what is a transition of care? A transition of care is the movement of a patient from one setting of care, hospital, ambulatory primary care practice, ambulatory specialty care practice, long-term care, home health, rehab facility, to another. At a minimum, this includes all transactions or transitions of care and referrals that are ordered by the EP. And do we have any other questions, Christine?
Hi, Cindy, we do not at this time.
Okay, so I've provided.
This is Connie. I do have one thing that I want to add to this is if you join the HIE or you are already a member of the HIE and you want to send a transition of care to the HIE, someone will help you with it. Don't be intimidated by this. It's very simple once you go through it, but there's always someone to help you from the Health Information Exchange. If you call our helpline, someone will help you, or get a hold of your account manager if you're already a member. That's it.
And so I've provided a list of resources for technical support. Contact HIE support at healthcurrent.org if you're unable to log in, if you're an established participant, if you're forgot your password or you're having some other difficulties. Of course, the Director of Programs is Connie. And then our Manager of Recruitment Engagement is Jamie Pena. And this is her email address, but also do recruitment@healthcurrent.org if you have any interest or you have any questions. Our Director of Client Services is Caitlin. And then here are our account managers. The Senior Manager that oversees the department is Sally. And then here's a list of our account managers. And if you are a participant, then you have been assigned to an account manager and are currently working with them as well. If you don't know who they are, you can either contact HIE support or Sally. And if there aren't any questions, that's all I have today.
Thank you so much, Cindy.
All right, thank you. Thank you very, very much, Cindy, for the wonderful job you did with this. I'll let Christine finish out now and explain what's going to happen.
Okay, thank you so much, Connie. Again, thank you for some great questions today. For each of you who have registered and participated in today's webinar, you will receive a copy of the webinar slide deck and the question and answers addressed during the call. This has been recorded and will be posted along with the Q&As to the Access and Health Current websites. This does conclude today's webinar. Thank you to Access for sponsoring the presentation today, and thank you to all for participating. Have a wonderful rest of your day. Thank you.
Thank you.